There is nothing like that feeling when you walk through the door and your dog runs up to greet you. Tail wagging, eyes bright, full of joy. It's that instant wave of happiness and connection we all know so well. As a hormone specialist, I certainly recognize the hormone responsible for that amazing feeling. That hormone is oxytocin. So what does oxytocin have to do with menopause? Actually, a lot. It's one of the most helpful but underutilized hormones in menopause care. Oxytocin is not just about puppies and babies. Oxytocin helps mood, bone density, and even libido, yet it's rarely offered as part of menopause therapy. But oxytocin is only one part of the story. In this video, I will discuss 10 menopause-related issues that many women and even many doctors miss because they either misunderstand certain concepts or simply are not aware of all the treatment options. There is a lot of confusion about menopause and perimenopause as well as hormone therapy. You may hear words like bioidentical, natural, synthetic, or phytoestrogens from plants, and it's easy to get confused about what they really mean. Hello, I'm Dr. Barron, a board-certified endocrinologist with over 2 decades of experience. I have treated more than 10,000 women specifically for menopause and perimenopause, helping them understand their options, weigh their risks and benefits, and make informed choices with clarity and confidence. Number 1, let's define menopause, perimenopause, and postmenopause. So many women ask me, "Doctor, how long am I going to be in menopause?" What they really mean is how long will the bothersome symptoms like hot flashes, night sweats, and brain fog last? That's a great question, but to really answer it, it's important to understand what menopause actually means. Menopause is the point when a woman has gone 12 full months without a period. It marks the end of the reproductive years when the ovaries stop releasing eggs and hormone production declines. The average age of menopause is about 51, but it can happen anytime between age 45 and 55 for most women. Technically, menopause lasts only one day, the day that marks 1 year since your last period. Before menopause comes perimenopause. Perimenopause is the transition time leading up to menopause. Hormones levels start to fluctuate, periods become irregular, and symptoms like hot flashes, mood swings, and sleep problems often begin. Women often notice that their periods become unpredictable. They might skip months and then have a very heavy period. Or they may notice their flow and timing change from month to month. They may also notice weight gain and changes in libido, which may actually go up or down. Perimenopause usually lasts around 4 to 8 years. Now, this is a very important point to understand. You can still get pregnant during perimenopause. Fertility may be lower, but your ovaries still release eggs occasionally, so pregnancy is still possible until you have gone 12 months without a period and reach that 1 day point in time we call menopause. After menopause comes postmenopause. That's everything after the 1 year mark without a period. During that time, your hormone levels stay low and steady. Now, here is where most of the confusion happens. Many women and doctors use the words menopause and postmenopause interchangeably, and that's how I will use them in this video as well. So going back to the question, how long would menopause symptoms last? The experience is different for everyone. Some women have very few symptoms during this time, and other women have severe hot flashes, night sweats, and sleep issues that can last for many years. Once you understand where you are in the transition process, you can make better choices for your health. Number 2, what does bioidentical hormones really mean? Bioidentical hormones are hormones that have the exact same chemical structures as the ones your body used to make before menopause. During menopause, your body stops making many of those hormones in the same amounts. Bioidentical hormones are designed to match your body's own hormones so that they behave the same way your natural hormones did. Some people call them natural or plant-based because their raw materials come from plants like soy or yam. But bioidentical hormones are not actual plants. No plant on earth produces human estradiol or progesterone in a ready-to-use form. What plants do provide are certain building blocks, molecules that scientists can modify in a lab to become identical to the hormones your body once made naturally. Estradiol, estriol, progesterone, DHEA, and oxytocin are bioidentical. They have the exact same chemical structure as your own. That means your body can recognize and use them the same way it did before menopause. On the other hand, Premarin, Prempro, and medroxyprogesterone acetate are not bioidentical. Premarin actually comes from the pregnant horse urine. That's actually where the name comes from. Pregnant mare urine. It contains a mix of at least 10 different estrogens, including estrone sulfate, equilin, and equilenin, which are found naturally in horses but not in humans. These estrogens have chemical structures that are different from human estradiol, so they don't act in the body exactly the same way. If a woman is taking Premarin and she goes and gets a blood test to check estradiol level, it will not pick up all the estrogens in her body because the horse-type estrogens are not bioidentical and would not be detected by the blood test. Prometrium is bioidentical progesterone, but medroxyprogesterone acetate is not. It is a synthetic progesterone in Prempro and other HRT formulations. This is important because unlike bioidentical progesterone that binds only to progesterone receptors, medroxyprogesterone acetate binds to androgen receptors and glucocorticoid receptors. That means that medroxyprogesterone acetate has side effects that are like male hormone side effects. It can lower good cholesterol, raise bad cholesterol, cause acne, oily skin, hair loss, and water retention. Medroxyprogesterone binding to the cortisol receptor causes side effects like bone loss, immune suppression, weight gain, and insulin resistance. Many experts think that the higher risk of breast cancer and blood clots in the large Women Health Initiative study were happening because the women in the study were using Premarin or Prempro and not bioidentical hormones. Number 3, phytoestrogens. Phytoestrogens are natural compounds that are found in plants, and they act a little bit like estrogen in the body. Commonly used phytoestrogens include soy, flaxseed, and red clover. They can bind to the estrogen receptors and either mimic estrogen when your own levels are low or block estrogen when your own levels are higher. This is a little bit confusing, so let me explain it this way. Imagine 3 levels of estrogen in the body: down low, medium, or high. Low, there is no estrogen, like what happens after menopause. In the middle is a phytoestrogen, the plant form, and up high is estradiol, the strong human estrogen your body makes or that you might take as part of hormone therapy. So here's the important thing to understand. If your estrogen level is very low, you're down here, and you take a phytoestrogen, it can lift you up a little bit. That small bump helps calm hot flashes and night sweats because those weak plant estrogens gently activate the estrogen receptors that have not been getting any signal. But if you are already up here, like in perimenopause, when your ovaries still make plenty of estrogen, or if you are already taking estradiol therapy, adding a phytoestrogen can actually push you down. Why? Because those weak plant estrogens compete with your own strong estrogen for the same receptors. Phytoestrogens are weaker estrogens, so they block the stronger estrogens from working. That's why some women start soy or red clover and their symptoms actually get worse, not better, because they're fighting against their own estrogen. So again, if you're low, phytoestrogens can lift you up a little bit. If you're high, they can pull you down. That's why for women already on estradiol or still making their own estrogen, it's usually better to use supplements that work in a different way, not by touching the estrogen receptors at all. 2 examples are black cohosh and Siberian root. Black cohosh works on the brain temperature control center to calm hot flashes, and Siberian root is an adaptogen that helps the body handle stress better and stabilizes temperature control. Number 4, progesterone. When I start a patient on hormone therapy, I usually begin with progesterone only for about 10 nights before adding estrogen. This is why in a normal menstrual cycle, estrogen builds up the lining of the uterus, progesterone keeps it stable, and when progesterone levels drop, the linings shed and you get your period. But during perimenopause and early menopause, women stop ovulating regularly. Without regular ovulation, the body doesn't produce enough progesterone. That means that the estrogen keeps building up the inner lining of the uterus, but nothing helps clear it out. So the lining just sits there, getting thicker and thicker over time. That raises the risk of endometrial hyperplasia. That's when the lining grows so much that it can turn into endometrial cancer if not treated. So when I start with progesterone only, it gives the uterus a chance to shed any hidden buildup before we add estrogen. If we skip that step and start both progesterone and estrogen at the same time, that old lining can cause random bleeding, or what we call dysfunctional uterine bleeding. Bleeding that's heavy, irregular, or unexpected. And when that happens, we have to stop therapy and do an endometrial biopsy to make sure nothing more serious is going on. And while biopsy is important, it can also be painful and stressful. So why add more stress when we can prevent it? I also do a progesterone-only challenge for women who come to me after using hormone pellets. Pellets often have very high doses of estrogen and testosterone, but they do not include progesterone. Women on pellets are usually told to take progesterone at night, but those doses were never studied with pellet therapy, and pellets themselves are not FDA approved. So we don't really know how much progesterone is needed to keep the uterus safe at those high hormone levels. That's why I always start with progesterone alone first, to let the uterus clear out and reset. I prescribe progesterone nightly for about 10 nights and then stop it and wait about 10 days to see if there is any withdrawal bleeding. If bleeding happens, it means there was some buildup of the inner lining that's now being shed. If there is no bleeding, it means the lining was already thin and did not need to shed. Once the lining is clear, we can start estrogen safely and comfortably without setting the stage for unnecessary bleeding and biopsies. And once we add estradiol, I recommend for my patients to take the progesterone every night continuously. It is best to take progesterone every night in order to prevent buildup of the inner lining of the uterus. My goal is to achieve a quiet endometrium, which means a thin lining and no shedding, by balancing out the estrogen and progesterone. Number 5, estradiol. It is really important to understand that not all estradiol is created equal. As this research shows, when you take estradiol by mouth, orally, it has to first pass through the liver before it reaches the rest of your body. This is called the first pass effect. That process makes the liver produce more clotting and inflammation markers, which can raise the risk of blood clots and other side effects. When estradiol is used topically through the skin, as a patch, gel, or spray, it enters the bloodstream directly and reaches steady levels before getting broken down later by the liver. So you get steady hormone levels without triggering those liver changes, making it safer and more natural option for most women. In addition, when estradiol is taken by mouth, a lot of it gets converted by the liver into another form called estrone. Estrone can then convert into 16-alpha-hydroxyestrone and 4-hydroxyestrone. 4-hydroxyestrone, as you can see in this article, can cause DNA damage. 16-alpha-hydroxyestrone causes receptor stimulation, as you can see in this article. This causes the cells to grow faster. Over time, higher levels of these metabolites from oral estrogen are linked to greater risk of breast cancer and uterine cancer. So now that we understand why topical estradiol through the skin is the safer choice, let's talk about the dose. The lowest dose of the estradiol patch can help prevent bone loss, while higher doses can actually build up bone density over time. For many women, even that small dose can help ease hot flashes and night sweats. The patch is placed on clean, dry skin on the lower belly or upper buttocks and is changed once or twice a week depending on the brand. So what are the risks of hormone replacement therapy? This is a table from Susan B. Komen website that summarizes the risks very nicely. If 10,000 women aged 50 to 79 took hormone replacement therapy for a year, 9 more of them would develop breast cancer compared to if they did not take it. 12 more would develop blood clots in their leg, 9 more would get blood clot in their lungs, and 9 more would end up with a stroke. Now it is important to understand that this data is based on the Women Health Initiative data when they used non-bioidentical hormones, and the hormone was started around age 60. Almost 10 years after menopause started. So it's likely that with bioidentical hormones, the risk is lower. Number 6 is estriol. Estriol is a naturally occurring, weaker form of estrogen compared to estradiol. In the US, there is no FDA-approved drug product that contains estriol. It is most often prescribed as a custom or compounded cream like Biased, which is a mix of estriol with estradiol. Those are typically applied to the skin. I often prescribe compounded estriol vaginally for women dealing with dryness, irritation, or discomfort. Vaginal estriol works directly on the tissues of the vagina to make them thicker, more elastic, and better lubricated. That helps relieve the burning, itching, and pain some women feel with intercourse or urination, a condition we call urogenital atrophy. Even very small doses can make a big difference, with very little of the hormone reaching the rest of the body. Number 7, testosterone. Like estriol, there are no FDA-approved testosterone products for women in the US. Testosterone is a hormone that women make naturally as well, not just men. It helps support libido, energy, mood, muscle strength, bone health, and even mental sharpness. When testosterone levels get too low, women can feel tired, lose interest in sex, or notice weaker muscles and lower motivation. Since there is no testosterone version made specifically for women, we can either prescribe a small amount of the men's product or a custom cream from a compounding pharmacy. The goal is to restore healthy levels, not to raise them too high. Too much testosterone can cause side effects like acne, unwanted hair growth, oily skin, or even a deeper voice. So it's important to use it carefully and monitor the levels regularly. Number 8. DHEA. This is another hormone that naturally goes down with menopause. DHEA is a weak androgen or male hormone. It helps support libido, muscle strength, bone health, mood, energy, and even the immune system. I sometimes prescribe DHEA as a compounded cream or tablet to gently boost these benefits, and it also helps women with menopause-related dry eyes. DHEA can also be used vaginally to help dryness, irritation, and pain with intimacy. There is an FDA-approved vaginal form called Intrarosa, as well as a compounded version of vaginal DHEA suppositories. Number 9. Now let's go back to discuss oxytocin. When we think about oxytocin, most people picture puppies, kittens, or babies, that warm, bonding feeling that makes you want to hold them and protect them. And that's true. But there is a lot more to this hormone than affection. Oxytocin helps protect the bones. It helps the bone building cells stay active, which maintains bone strength over time. It also helps with muscles. Oxytocin supports muscle repair and recovery, helping maintain tone and strength as we age. In addition, oxytocin can help with weight and body composition. Studies show that oxytocin may reduce fat mass and increase lean body mass, helping the body stay fit and balanced. It also improves the mood. When oxytocin levels are healthy, people feel calmer, more positive, and less anxious. Some even sleep better and feel more emotionally balanced. Then there is libido. Oxytocin helps restore natural desire and connection, that sense of attraction and closeness that can fade during hormonal changes. And it even benefits the skin. It supports collagen and elasticity, giving the skin a more vibrant and youthful appearance. So how is it taken? Oxytocin is usually prescribed as a troche or liquid drops that dissolve under the tongue. The most common dose is 40 to 100 international units once or twice a day. So what are the side effects? Oxytocin is usually very well tolerated, but some people can experience mild headaches, flushing, or a temporary sense of increased fear or anxiety, especially if they start taking it during a stressful or unfamiliar time. That's why I recommend beginning oxytocin at home when you feel relaxed and secure, not while traveling or under pressure. To me, this is the hormone treatment that sounds almost too good to be true. It helps with so many things. It is well tolerated with minimal side effects and risks. The best reaction I ever got was from a patient who took careful notes about all the treatment options we were discussing and then looked at me and said, "Wait, you're telling me there is a hormone that can make me skinny, sexy, young looking, sharp, and give me strong bones and muscles? Sign me up." Finally, number 10. One important thing to remember is that not all hot flashes and sweats are caused by menopause. I often see women who have been in menopause for many years and suddenly start having new sweats. When that happens, I don't automatically assume it's from menopause. I look for other possible causes. Sweats can be sometimes caused by an overactive thyroid, which speeds up your metabolism, or by low blood sugar, which makes you feel shaky and sweaty. Sweats can also be caused by infections, or certain cancers like lymphoma, or rare conditions like acromegaly in which there is too much growth hormone, or carcinoid syndrome that releases chemicals into the bloodstream. Some women get sweats because of medications like Cymbalta, or after stopping medications that kept sweats under control, like Paxil or beta blockers. So, if you start having new sweats years after menopause, it's worth checking for other causes before assuming it's all menopause related. If all this sounds like a lot to take in, you're right, it is a lot of information. But the good news is that women today have a lot more options than ever before. The goal is to find what works best for you, because every woman's body, goals, and priorities are different. I plan to make more videos about this important topic, so please leave a comment about any menopause related topics you would like me to cover next. Thank you very much for listening. If you found this video helpful, please subscribe, leave a like, and share it with a friend who may need it. It really helps more women find this information and take control of their health. This video is for educational purposes only, not medical advice. See you in the next one.